1. A pearly pimple. Skin cancer is the most common type of cancer, and there are several different types. The main ones are squamous cell carcinoma, basal cell carcinoma, and, somewhat less common, melanoma. Mark Glashofer, MD, a board-certified private practice dermatologist specializing in skin cancer in northern New Jersey, said that basal cell carcinomas sometimes have a pearly translucent or waxy appearance. Other times, these cancers look like sores, scaly patches, or cyst-like bumps. 2. Foreign body sensation. A lump in the throat feeling can be a sign of base of tongue and tonsil tumors. These tumors can be caused by human papillomavirus, HPV, infections, which are often acquired through oral sex. HPV can lie dormant in the body for years before producing symptoms, so people may not know they are even at risk of oral, head, and neck cancers. 3. Prolonged itching. Some cancers, like lymphomas, can make people extremely itchy. Lymphomas are types of cancer that affect the lymph system, part of your immune system. They include Hodgkin and non-Hodgkin lymphoma. Regardless of the type, lymphomas can cause itchiness. 4. Ear pain. Many conditions can trigger referred otalgia, or ear pain that travels to the ear from nerves in the head or neck. One of them is oral cancer. It could also be a sign of a later stage mouth cancer that is burrowing down and starting to interfere with those nerves. Bruce Davidson, MD, professor and chairman of otolaryngology, head and neck surgery at Georgetown University Medical Center in Washington, D.C., told Health. 5. Vaginal bleeding. Unusual bleeding can be a sign of endometrial cancer, or a more common type of uterine cancer that can be cured. Any abnormal bleeding should be promptly evaluated, especially after menopause or before in those with risk factors, such as obesity. 6. A droopy eyelid. A droopy upper eyelid can alert healthcare providers to a Pancoast tumor, a type of lung cancer that starts in the upper lung and spreads to nearby tissues. It can cause severe shoulder pain or Horner's syndrome, or a droopy eyelid, constricted pupil, and loss of sweating on one side of the face. 7. Scaly patches or warty lumps. A red, scaly patch of skin on a sun-exposed area that persists for weeks could be a sign of squamous cell carcinoma. It often appears on the head, neck, back of the hands, or front of the legs and may have a warty-looking or dome-shaped appearance. Squamous cell carcinoma is almost always curable when caught early. 8. Anemia. Blood in your stool is a classic sign of colorectal cancer, which can bleed into the digestive tract. This blood loss can lead to anemia or low red blood cell counts over time. Rectal bleeding may not be easily detectable. It tends to be microscopic bleeding. Craig Moskowitz, MD, chief oncologist at the University of Miami Health Systems Sylvester Comprehensive Cancer Center, told Health. 9. A hoarse voice. Laryngeal cancer attacks tissues in the voice box, larynx, which houses your vocal cords. This type of cancer might cause hoarseness, throat pain, ear pain, or a lump in the neck or throat. Cancer of the larynx can also spread to the thyroid, trachea, windpipe, or esophagus. 10. Belly bloat. In rare cases, bloating and pelvic discomfort are signs of ovarian cancer. Ovarian cancer affects about 1.1% of women throughout their lifetime. Having a family history of ovarian cancer can mean you have an increased risk for the disease. 11. A lump in your neck. A lump in the neck can be due to thyroid disease or cancer. All neck lumps in children and adults should be checked by a healthcare provider. Most lumps in adults are not cancerous. The risk of throat cancer increases with age, smoking, or heavy alcohol use. 12. Breast swelling or dimpling. Unusual breast changes require immediate attention. You will want to watch out for the following signs and symptoms. Breast pain. Changes in the size and shape of the breast. Dimpling or puckering, scaling, redness, and swelling. A new lump or thickening in the breast or armpit area. Nipple discharge. A nipple that has turned inward. There are many types of breast cancer. Examples include ductal carcinoma, lobular carcinoma, inflammatory breast cancer, and Paget's disease of the breast. 13. Bone pain. Bone pain may be the result of an injury, infection, or osteoporosis. It can also be a sign of cancer. Unexplained bone pain, especially in the spine, pelvis, and ribs, may be a symptom of multiple myeloma. Multiple myeloma is a cancer of plasma cells. Normal plasma cells are found in the bone. marrow, and are an important part of the immune system. Bone or joint pain with fever, fatigue, or weight loss can be a sign of leukemia, a type of blood and bone marrow cancer. 14. Pain after drinking alcohol. In rare cases, unexplained pain after consuming alcohol suggests Hodgkin lymphoma, a cancer that starts in white blood cells called lymphocytes. Usually, these patients can have some swollen lymph nodes in the neck or the chest, said Dr. Moskowitz. Hodgkin lymphoma can start almost anywhere in the body. The most common sites are the lymph nodes in the chest, neck, or under the arms. 15. Urinary problems. Urinary symptoms can sometimes occur with bladder cancer, which is the sixth most common cancer in the United States. Less commonly, bloody urine is a symptom of bladder or kidney cancer. Kidney cancer is one of the 10 most common cancers in the United States. It is about twice as common in men as in women. The average age of people when they are diagnosed is 65 years old. When to see a healthcare provider. Keep in mind that not every new symptom you experience will be cancer. Pay close attention to changes in your body and new symptoms, including pain. A healthcare provider can take a medical history, do a physical exam, or order tests if you detect any changes. Do not skip regular screenings. Some cancers can be found early, before they have had a chance to grow and spread. Some symptoms, such as a lump in the breast or suspicious moles, create a sense of urgency as they can be warning signs of cancer. Any new or unfamiliar symptoms, like swelling in your neck, ear pain, or skin sores, warrant a visit to a healthcare provider to get diagnosed and take appropriate action. By Karen Pallarito, medically reviewed by Archana Sharma, do@health.com.